So this video is me demonstrating a entire newborn exam after birth. Currently, baby and mom are skin to skin with a warm towel over them, and we have the cord still attached to baby at this time. To begin, I would gain consent from the parents and say that I would like to begin the newborn exam. And I'm going to do as much of it as I can with you and baby still skin to skin. And then when necessary, we'll move baby to right next to you and complete the rest of the exam. And then after I gain consent, then I will begin. And I'm going to begin by touching the fontanelles and finding those soft spots on baby's head. And note if they are bulging or depressed, anything abnormal. Let's scoot everybody closer. Following suture lines, feeling if there's any significant molding that I need to note in my chart. Otherwise, that looks good. I'm going to take a visual assessment of baby's eyes, ears, placement, see if there's anything, if the ears are set lower or anything abnormal there. Also, while I'm at the ears, I want to see if there are any skin tags, dimples, anything that might show that baby has an underdeveloped inner ear or middle ear. And if that's the case, then I would have a conversation including that baby may not have fully formed ear when discussing the newborn hearing exam as part of their full informed consent or informed choice on that. So check both ears, look at the eyes. If their eyes are opened, I would take my ophthalmoscope and flash it in their eyes, looking to see if they have that that orange glare to check to see in the back of their eye. Otherwise, then we would go on to, I would check the cartilage. This ear doesn't move on this baby, but checking cartilage, which is part of the New Ballard score, to see what they would rank there. So if it's pretty thick and the ear is stiff, so I give that a 4 for this baby. I would check the sucking and rooting reflex. So first for rooting, I may have seen this already with trying to start nursing with mom. Otherwise, I would touch their skin on their cheeks, see if they move their way towards the side I'm touching. For the sucking reflex, I would stick my finger with the pad upward and have baby suck, feeling how strong the suck is, feeling if the palate is complete on baby, and then seeing if I can see any lip or tongue ties that would be problematic. After that, I would just move my way down to the clavicles, feeling if I feel any sort of crunching or like anything was broken there. Otherwise, just moving my way down the chest, feeling breast buds. This is also part of our New Ballard score. And then this baby has full areolas, although they aren't different colored on the doll, but they're about that 5 to 10 millimeters. So that would give baby a full score on that, which is a 4 as well. So while I'm here, keeping baby nice and close to mom, we're going to do our temperature. Got my thermometer, turn it on, stick it under baby's armpit, and kind of hold their arm there. See if maybe they want to nurse during this time because they hate that thermometer in their armpit. But after this will go off telling me the temperature, and then I would write that down on my chart. If the baby's temperature was too warm at this point, I would still keep baby skin to skin with mom, but just kind of take off a little bit of the towel or trade it out for a lighter blanket. maybe I'd take this light gauze one and trade it out. And I would tell mom if baby felt too cold, then we would put on a heavier towel, dry warm towel or blanket. And then if they have a hat that they prefer, we could put a hat on baby too. I'm not a big fan of the hats, especially with the babies with really wet heads, with lots of hair, but parents' preference, so we'll work with that. While we're at the chest, I'm going to take my stethoscope and assess their lungs, heart rate, and then bowel sounds. So, got my stethoscope. And mom, I'm going to listen to both the front and back of baby for lungs, and then check the heart in all 4 quadrants. So if I'm here a little long, don't get nervous, everything's fine. I'm going to listen for a full minute for both lungs and heart. So first we'll do the lungs on the back. And then in multiple different spots, 2 different spots on both sides, both lungs, making sure I'm hearing, noting if I'm hearing any crackling or wheezing, any sounds that maybe one lung sounds more full or deeper than the other one while breathing, noting any differences in that. And then do that on the front side as well, and then listen for a full 60 seconds getting respirations. And we'll say baby's rests were 60, nice and easy. So I'd write that down on the respiration rate. And then for heart, I'm going to listen in all 4 quadrants, and then again for 60 seconds to get the heart tone. And then I would write that down. We'll say baby got 120 on that. So all is normal for that. Oh, and then I want to listen to our bowel sounds now. Make sure we have bowel sounds all along the abdomen. Just listening for that crackling noise. That sounds good. And now, while we're at the abdomen, I'm going to feel if cord has stopped pulsing, and it feels like it, and it's nice and white. So we are going to clamp and cut that. I have 2 clamps for this. Normally I have 1 clamp and 1 is a sort of like a safety pin that I use. That's closest to baby so that I can slide we use a rubber band for the umbilical cord. But right now I don't have the safety pin one, so we're just going to use 2 hemostats. So we'll do 1, make sure we get the whole cord. This one's kind of a juicy one. And then do another clamp right here. And then whichever parent wants to cut the cord can. Otherwise, if neither of them are interested, I can do it. I take this paper towel and stick it kind of underneath the cord so that in case the blood splurts, if there's leftover blood in the vessels. And then I just instruct parents that the cord is really tough, kind of like a toenail, so just go ahead and snip it. And also that there's no feeling in it for baby or mom. So just have them go ahead and cut the cord. And then we would be able to move baby from mom's chest if we need to for the further newborn exam. Set our tools down. And then we can set the placenta away now. Okay, so next I'll say, Mom, is it alright if I just set baby right by your legs so that we can keep so that I can do a full visual inspection of them. And once I gain consent, I'm going to take baby and set them right here. Then I just like to keep them covered as much as possible, only showing off the spots that that I need to assess. So I've done this so far. Usually when I move mom away or baby away from mom, they're going to do their startle reflex. So I would note that. And then there we have startle reflex. And then making sure that both arms are moving at the same time. And like evenly, so that also rules out the collarbone breaking. And then also at this time, I can do our arm recoil, our check the baby's posture, do all those New Ballard scores. So check the square window, which doesn't really do on this baby, the popliteal angle, and the scarf sign, which doesn't really work on this baby either, and then the heel to ear. So checking all of those and marking them off, doing our reflexes, so our grasp, and then our Babinski with just tickling up and seeing if their toes flail, and then putting our hands on the ball of their feet and seeing if they curl in. So all of those are good. I'm going to check baby's bottom. And this baby is a little girl. She is actually anatomically correct. Her labia are completely closed, which shows maturity on our New Ballard score. And that gives us a 4 on that as well. And then if baby had terminal mech, then I would tell, I would mark that as the anus is patent. If they haven't, I would assess it and check and see, and it looks like it's present, so I would mark that it's presumed patent at this time. Here I would check our hips, make sure we have full rotation. Any clicking noises would be noted, but all looks well there. And then we would do the fun part, which a lot of parents look forward to, which is our measurements. So have this, my little notes so that I can write down our measurements. And we do our head first. Start at the top. And then I do it in centimeters, but then I convert it because sometimes that doesn't mean much for parents if it's in centimeters. So we have 36.5 for our head. Which 36.5 equals 14.5. And then inches long. And then we'll do our chest. Lift up their arms. And here we get 33, which is 13 inches. And then our length. Sometimes I like to have one of the parents help me with the length by holding the measuring tape at the top of their head while I try and get baby's legs straight. And then here we get, looks like 19 for our length. And then I like to ask parents what their guess is for weight while I get my measuring or my scale and sling all ready. It's always fun to do. And here we just lay out my sling. Oh, well, first I would like to measure the sling itself and then hit the tear button. And then we lay it out, put baby on there. Make sure head and bottom are both in really well. And then do it pretty quickly. But we don't want them hanging too high above. And this baby's only 2'8", but we'll give them 7 pounds, 6 ounces. Good job, honey. And then here I would just put on diaper for baby, and I take the time to explain. I like to put some oil on the bottom for to help with wiping, because the neck is very sticky. So if they've had a baby before, they might remember that, but oil helps wipe it off a lot easier. Then, depending on if it's a boy or girl, I would explain some things about diapering and let them know that, like, with this little girl, it's not abnormal if we have some bleeding in the diaper. That's just what we call pseudomenses, and that is just baby processing the hormones that mom had. And for a little boy, I like to tell them to make sure penis is pointed downward and umbilical cord is outward, so that we don't want the umbilical cord for either boy or girl to be caught up in pulling on the blanket or on the diaper. And then the penis, if it's pointed upward, it might shoot out of the diaper. So I like to explain that to parents, that if it's pointed down, then we know that it's not going to shoot out of the diaper. And I just want to look over and make sure that I got everything, and ask parents if they have any questions. But other than that, everything looks great. And then I leave mom and baby to bond some more, maybe work on breastfeeding, or do whatever they feel like, some resting.